Good morning. This recording is going to cover Chapter 10, which looks at personal control beliefs. Our expectancies of what will happen and how well we can cope with life's challenges have very important motivational implications. If you started university and you didn't expect to graduate, you didn't expect you were going to pass a particular course, or you didn't think you'd get a job after graduation, these things are very motivationally problematic. Similarly, in your interpersonal relationships, if you expect others not to like you, you think that other people aren't going to care about your welfare, or that they're only going to express hostility against you, again, this is going to be very problematic for your motivation to sustain those relationships. In all aspects of our life, our expectancies about our performance have an influence on how we perform and how motivated we are to succeed. The focus of this chapter is the motivation to exercise personal control over what happens to us. As we've already talked about this semester, the environments that we live in and operate in are both predictable and they're very responsive to our control attempts. We can often figure out what we need to do in order to exert control over our environment, and as a result of that, we can figure out what we need to do in order to exert control over our life's outcome. The strength with which we try to exercise personal control can be traced to the strength of our expectancy that we will be able to exercise that control. These expectancies about what the future holds and how well we will cope with the pending future are generally based on our past experiences as well as our current personal resources. There are two different types of expectancies: efficacy expectations and outcome expectations. An efficacy expectation is a judgment of how well you can do something. So in this case, the question is, can I do it? An outcome expectation, on the other hand, is a judgment about whether or not the course of action will lead to the desired outcome. So the question in this case is more, will it work? So if we look at the example on screen, when talking about efficacy expectations, it's the expectation of being able to enact the behaviors you need to in order to cope effectively with the situation at hand. So if I can run a mile every day this week, if I can control my fright and ask this person to the dance, if I can control my temper and be polite to the officer. So it's if you can do the behavior. But then when we're talking about outcome expectations, it's will that behavior we've done actually lead to the desired outcome? So it's the expectation that behavior will produce positive outcomes or prevent negative outcomes. So again, the efficacy expectation was, can we run the mile? But then we also need to know if that will work. So will that lead to us losing the 2 pounds we're trying to lose? If you can control your fright and ask the person to the dance, yes, you've executed the behavior, but will that lead to an acceptance of the invitation, and will you have fun? So will the effort translate into the desired outcome? And again, lastly, if you can control your temper, will that allow you to save yourself the $200 ticket? So again, will the behavior actually work and lead to the desired outcome? Both efficacy and outcome expectations must be reasonably high before behavior becomes energetic, goal-directed, and sustained over time. Analyzing these two expectancies makes it clear why people so often avoid behavior. So to do things like to speak publicly, to go on dates, to compete, whether it's in sports or whatever you might be competing in, or to interview for jobs, the person must not only be confident in their efficacy to execute the correct behaviors, but they also have to be reasonably sure that the efforts that they've put in will actually pay off and lead to the desired outcome. Any hesitation about either of these serves to weaken their motivation to perform the behaviors. A related concept is self-efficacy, which is an individual's belief in their ability to use their skills and resources to perform or cope in various situations. Self-efficacy is not the same as ability, because it requires not only skills or ability, but also the confidence to translate those skills into effective performance, especially under difficult circumstances. So it's more than just being good at something under ideal circumstances. It's being able to persevere even when conditions are poor. So a skillful chef can make a delicious meal with good ingredients, but a skillful and truly self-efficacious chef can make a delicious meal even with mediocre ingredients. This self-efficacy is just as important in determining competent functioning as is ability, because performance situations are often stressful, ambiguous, and unpredictable. And as one performs, circumstances are often changing, meaning people need to be flexible and adaptive. Thus, in everyday situations like driving, test taking, performing an athletic feat, etc., there are tons of things that can change and cause the conditions to be suboptimal. And research has shown that self-efficacy makes a significant contribution to performance and outcomes. The opposite of self-efficacy is doubt. When one doubts their abilities, any surprises, setbacks, or difficulties will create anxiety, confusion, negative thinking, and aversive psychological and physiological arousal, as well as bodily tension. Thus, self-efficacy versus self-doubt is the motivational variable that determines the extent to which an individual copes well versus poorly when their skills or abilities are stressed. Boiled down to its essence, self-efficacy predicts the motivational balance between wanting to give it a try on one hand and anxiety, doubt, and behavioral avoidance on the other hand. Self-efficacy beliefs arise from one's personal history in trying to execute that particular behavior or way of coping, observations of similar other people who have also tried to execute that behavior, verbal persuasion or pep talks from others or from the self, and physiological states such as a racing versus a calm heart. The extent to which an individual believes that they can competently perform a particular behavior stems from their personal history of trying to perform that behavior. Thus, people learn their current self-efficacy from their interpretation and memories of past attempts to execute that same behavior. Memories of past successes increase self-efficacy, while memories of past incompetencies lower self-efficacy. So for example, if you're trying to learn how to snowboard and the first time you're out, you find that you can stand up on the board, you could do a little bit of sliding without falling, that's going to leave you feeling pretty good. And this is going to increase your self-efficacy. However, if you instead fall down at every attempt and everyone seems to be making progress, except for you, this will likely lower your self-efficacy. Once self-efficacy for a certain behavior is quite high, occasional incompetencies or occasional shortcomings are tolerated and do not generally lead to a huge change in self-efficacy. If the performer is less experienced, so they lack a behavioral history, they don't have prior instances to think back on, each new competent or incompetent attempt will inform future efficacy. So this is a very important point in teaching situations in which learners are trying out new behaviors and activities. If they don't have much of a behavioral history, you need to make sure that they have a positive experience, because if they have an immediate negative experience, that's going to have a really bad effect on their self-efficacy, and it's likely going to deter them from trying the behavior again. Whereas if you can make sure that their first attempt is a positive experience, it's a lot more likely they'll try the activity or the behavior again, even if they weren't completely successful on the first attempt. It's important to note that of the 4 sources of self-efficacy, personal behavioral history is the most influential or has the largest effect on someone's self-efficacy. The second influence on self-efficacy is vicarious experience, which involves observing someone else enact the same course of action that you're about to enact. So the kind of, you go first and I'll watch. Seeing other people perform masterfully or do a good job at something raises the observer's own self-efficacy. This is because seeing similar people perform the same behavior initiates a social comparison process. So if they can do it, so can I. But vicarious experience works the other way as well, because observing others perform the same behavior poorly lowers our own self-efficacy. So if they can't do it, what makes me think I can? The extent to which the other person's enactment or attempt affects our own efficacy depends on 2 factors. First, the greater the similarity between the model and the observer, the greater the impact of the model's behavior will have on the observer's efficacy, or their efficacy forecast, how well they think they'll be able to do. Second, the less experienced the observer is at the behavior, so if they're brand new at doing this behavior, the greater the impact of the vicarious experience. So vicarious experience is a potent source of efficacy for relatively inexperienced observers who watch similar others perform. Verbal persuasions or pep talks can also serve to increase self-efficacy. When effective, pep talks persuade the performer to focus more on personal strengths and potentials and less on personal weaknesses and deficiencies. Pep talks shift a performer's attention from sources of inefficacy to sources of efficacy. But verbal persuasion only goes so far if it's contradicted by actual experience. So if at the end of the first half of your soccer game, your team is losing 10-0, and the coach is trying to convince you that you can go back out and bring home the big win, this pep talk probably won't work because you realize that coming back from a 10-0 deficit is quite impossible. The effectiveness of the verbal persuasion is also limited by the boundaries of the possible in the mind of the performer, and it depends on the credibility, the expertise, and the trustworthiness of the persuader. So an example of this, I know when I was in grad school and I was stressed out about something, I'd go home and my parents would be like, oh, don't worry about it. You're going to ace that thing that you do at school that I have no idea what you actually do. And so when they gave me a pep talk and said, like, I know you can do it, it really wasn't that helpful. But if I then went into school and my supervisor, who actually knew what I was working on, would say, you got this, just spend another couple hours on it and you'll get it figured out. That pep talk worked a lot better because that person actually was an expert in what I was doing. And so I knew that they were a good judge of whether I was capable of completing that task. Whereas again, I know my parents were being supportive, but they weren't really credible in terms of judging my ability to complete that particular task. It's important to note that individuals can also give themselves pep talks, usually in the form of self-instruction, that can boost efficacy at least for a little while. What's important to realize is verbal persuasion works to the extent that it provides the performer with a temporary efficacy boost to generate the motivation necessary for another try. So basically that's the entire purpose of the pep talk, is to motivate the individual enough that they don't give up and they give it another try, because obviously the longer you persist, the greater your chance of success. Looking at our physiological state, fatigue, pain, muscle tension, mental confusion, trembling hands, these are all physiological signals that the demands of the task we're currently participating in exceed our capacity to cope with the demands. An abnormal physiological state is a private yet very attention-getting message that contributes to our sense of inefficacy. An absence of tension, fear, anxiety, and stress, on the other hand, increases our efficacy by providing first-hand bodily feedback that we can indeed cope adequately with what's going on. So the relationship between efficacy and physiological activity is bidirectional. Inefficacy heightens our arousal, and heightened arousal then feeds back to fuel our perceived inefficacy. So again, when we don't have the skills to cope with whatever we're participating in, generally we're going to feel shaky. Our heart's going to be racing. We're not going to feel great about what we're doing. And those physiological symptoms or those physiological states are going to feed back in and cause us to perceive our performance as inadequate, again, leading to a greater feeling of inefficacy. Physiological information tends to communicate efficacy information most when our initial efficacy is uncertain. So when someone's performing a task for the first time. When it's a more regular task, efficacy is more certain, so people sometimes discount or even reinterpret their physiological cues as a positive source of efficacy. So again, if your hands are shaking, maybe you interpret it as, I'm pumped up for this, rather than my hands shaking mean that I'm nervous. I won't lie, when I stand up in front of you guys each week to teach, my stomach still does flips, and sometimes my hands are still shaking, and sometimes I still feel like I want to yak. Thank you, anxiety. But since I've been teaching for about 7 years now, and I've given well over 100 lectures, I can usually take a deep breath and I can usually ignore the physiological cues as I know things are going to be okay. So again, I can use my personal behavioral history to override these physiological cues so that I still feel efficacious, or I still feel like I'm in control of the situation and I can control the outcome. So to summarize, as people face challenging and difficult circumstances and ready themselves to carry out a course of action, there are 4 sources of information they rely on to forecast how well they're going to perform. Consider you're sitting in the audience at a conference and you're the next presenter up. How eager or motivated you will be to get up and speak depends on how well you've fared in the past with public speaking, how well other speakers that day have fared, and the conversation of encouragement versus ridicule coming from your mentor or from yourself, and the message of panic versus cool, calm, and collected that your body is sending you as you wait your turn. By itself, none of this information determines your efficacy or predicts your presentation performance. Instead, through reflective thought, you select information to attend to. You weigh the importance of each of these sources of information, and you eventually integrate all of this information into an overall self-efficacy judgment. Importantly, the first 2 sources of efficacy information, so personal behavioral history and vicarious experience, are generally the stronger sources of efficacy belief. Thus, they are behaviors that should be targeted when you're trying to improve someone's self-efficacy. Once formed, self-efficacy beliefs contribute to the quality of human functioning in multiple ways. Generally speaking, the more people expect that they can adequately perform an action, the more willing they are to put forth effort and persist when facing difficulties. In contrast, when people expect that they cannot adequately perform the required task, they are not willing to engage in activities requiring such behavior. Instead, they slacken their effort, they prematurely settle for mediocre outcomes, and they quit in the face of obstacles. More specifically, self-efficacy beliefs affect the choice of activities and selection of environments, the extent of effort and persistence put forth during performance, the quality of thinking and decision-making during performance, and the emotional reactions, especially those related to stress and anxiety. People continually make choices about what activities to pursue and which environments to spend time in. As a kid, we chose adventure camp or drama camp. As young adults, we chose university or trade school, etc., etc., etc. In general, we tend to seek out activities and situations that we feel capable of adjusting to or handling, while we actively avoid situations that we see as things that will overwhelm our coping capacities. If a student expects a math class to be overwhelming, confusing, and frustrating, then doubt overwhelms efficacy and produces an avoidance decision, such as withdrawing from the class discussions or not enrolling in the class in the first place. The same doubt-plagued avoidance choices apply to social opportunities, such as dating, dancing, participating in sports, and career paths pursued and avoided. When people avoid an activity out of doubt over their personal competence, they participate in the self-destructive process of retarding their own development. The more they avoid such activities, the more entrenched self-doubt becomes, because they never get the chance to prove themselves wrong, and they eliminate opportunities to observe expert models or receive instruction. And such a pattern of avoidance progressively narrows people's ranges of activities and settings. So if you continually avoid settings because you fear you won't be successful in those settings, then you are giving up the opportunity to prove yourself wrong and to prove yourself that you are competent in those settings. And the more you do it, the more you cut down the opportunity to explore new environments because you're always doubting your abilities. As people perform, self-efficacy beliefs influence how much effort they exert, as well as how long they put forth that effort in the face of adversity. Strong self-efficacy beliefs produce persistent coping efforts aimed at overcoming setbacks and difficulties. Doubt, on the other hand, leads people to slacken their efforts when they encounter difficulties and perhaps give up altogether. Self-efficacy plays a pivotal role in facilitating effort and persistence, not because it silences doubt following failure and rejection, because these are expected and normal reactions. Instead, self-efficacy leads to a quick recovery of self-assurance following these setbacks. For example, let's say that you intend to eventually go to medical school. These schools receive hundreds of applications each year, and depending on where you apply and who you are up against in your year, regardless of how impressive your marks and experiences are, there's no guarantee you're going to get in. That being said, if you do not get accepted, your degree of self-efficacy will dictate whether you have the motivational support necessary for continuing the persistent effort needed to eventually make it to medical school and become a doctor. To illustrate this point, Bandura and other self-efficacy researchers quote stories of resiliency. For example, Michael Jordan was cut from his high school basketball team in the 10th grade. Walt Disney was fired by a newspaper editor who said he lacked imagination. Decca Records turned down a contract with the Beatles, saying, "We don't like their sound." And J.K. Rowling was rejected by 12 different publishers before Harry Potter and the Sorcerer's Stone became an accepted manuscript. So again, failure is a normal part of life, but self-efficacy can help to predict how this failure influences performance. People who believe strongly in their efficacy for problem solving remain remarkably efficient in their analytic thinking during stressful episodes, whereas people who doubt their problem-solving capacities think erratically and show both confusion and negative thinking. A strong sense of efficacy allows the performer to remain task-focused, even in the face of situational stress and problem-solving dead ends. In contrast, self-doubt distracts decision-makers away from such task-focused thinking because attention shifts to their deficiencies, and this overwhelms the task demands. In other words, doubt deteriorates, whereas efficacy buffers the quality of a performer's thinking and decision-making, especially during stressful situations. Before performers begin an activity, they typically spend some time thinking about how they will perform. Individuals with a strong sense of efficacy attend to the demands and challenges of the task. They visualize competent scenarios for forthcoming behaviors, and they exude enthusiasm, optimism, and interest. Individuals with a weak sense of efficacy, however, dwell on personal deficiencies, they visualize possible obstacles, they exude pessimism, anxiety, and depression. Once performance begins and things start to go wrong, strong self-efficacy keeps anxiety at bay. People who doubt their efficacy, though, are quickly threatened by difficulties. They react to setbacks and negative feedback with distress, and they see their attention drift towards personal deficiencies and negative emotionality. As self-efficacy increases, fear and anxiety slip away. Self-efficacy researchers go as far as to say that the root cause of anxiety is low self-efficacy. Therefore, any increase in self-efficacy means a corresponding decrease in anxiety. I can personally attest to this fact. As I've told you a million times already this semester, I've suffered from a lot of anxiety issues throughout my life, and they're things that are still reoccurring for me. But I've noticed that the more I power through these issues, the better the anxiety seems to get. Because when I start to feel anxious about something that's pending, a lot of my self-talk involves evaluating all of the other times I've succeeded, or the other scary things that I've done but I've succeeded in. And that seems to, over time, reduce my anxiety. So again, when you have these negative thoughts where you're doubting your performance, that's what's leading to your anxiety. It's the, oh my God, what if this happens? And what if this negative thing happens? Or what if I screw that up? And if you work on instead replacing those negative thoughts with, well, last time I did a similar thing, I was really successful. Or for me, when I go to teach and I'm feeling a little bit anxious, I say, remember last lecture? You didn't throw up. You didn't do anything really stupid. You didn't fall down in front of people. And by reminding myself of all my past successes, it actually helps to reduce my anxiety. So again, it's a good thing to think about if you're someone who does suffer from anxiety. Instead of focusing on all the negative things that might happen, shift your attention to your own personal behavioral history and all the times that you did a really good job of similar behaviors, and that should help to increase your self-efficacy and increase your approach behaviors or your willingness to try new things. 2 practical points about self-efficacy are very important to highlight. First, self-efficacy beliefs come from personal behavioral history, vicarious experiences, verbal persuasion, and physiological states, as we've already discussed. What makes this a very practical point is it means that high self-efficacy beliefs can be acquired and they can be changed. Second, the level of self-efficacy predicts ways of coping that can be called competent functioning or personal empowerment. So to empower oneself, people need more than just skills and knowledge of what to do. People also need self-efficacy beliefs so that they can translate their knowledge and skills into effective performance when threatened, and so they can exert control over intrusive negative thoughts. Mastery beliefs reflect the extent of perceived control an individual has over attaining desirable outcomes and preventing adversive ones. When personal control beliefs are strong and resilient, the individual perceives a strong causal link between actions and outcomes. When personal control beliefs are weak and fragile, the individual perceives that personal initiatives and actions produce little effect on what happens to them. When people engage in a task, some outcome is typically at stake. During such task engagement, people make a subjective forecast of how controllable versus uncontrollable the outcome at stake is. Even something as simple as going out on a Friday night. The outcome can be a good time or a bad time. And during the planning or even during the event, the individual is generally thinking about whether it is going to turn out to be a good night or a bad night. When people expect the desired outcome, like having fun, making friends, meeting the love of their life, or an undesired outcome, their feet hurting, not meeting anyone, feeling like an outcast, when they expect that these outcomes are independent of their behavior, they develop learned helplessness. Learned helplessness is the psychological state that results when an individual expects that life's outcomes are uncontrollable. Boiled down to its essentials, learned helplessness can be understood by the strength of the perceived relationship between the person's behavior and the person's fate or outcome. The relationship between one's behavior and one's outcome can be very high, as you see in the top graph, which represents a mastery orientation, when their behavior directly links to outcomes that happen to them. In contrast, the relationship between one's behavior and one's outcomes can be non-existent, as represented by the dashed and thin arrow between what one does and what outcomes occur in the bottom graph. This represents a learned helplessness orientation. For example, this person may believe that it's all about the other people that show up at the bar that night that's going to determine whether they have a good time. Regardless of what they do, it's not going to control the actual outcome of the night. Importantly, helplessness is learned. Consider the following experiment. In phase 1 of the experiment, 3 groups of dogs were administered either an inescapable shock, an escapable shock, or no shock. So this was the control group. Dogs in the 2 shock groups were placed into a sling and given mild 5-second electric shocks once a day for 64 consecutive days. In the inescapable shock group, no response could terminate the shock. Whether the dog barked, howled, or thrashed about frantically, the shock continued for the full 5 seconds. Again, that's why it's considered the inescapable shock group. In the escapable shock group, the dogs could terminate the shock. If the dog pressed a button that was mounted on the wall, placed just in front of their nose, the shock stopped. So in this case, the outcome or the shock was actually controllable. In the no shock control group, dogs were placed into a sling just like the dogs in the other 2 conditions, but they did not receive any shocks. So again, if you look at the graph on screen, we're talking about phase 1. We have an inescapable shock group who received shocks and nothing they could do would stop the shock. The escapable shock group who received shocks, but they could press their nose on a button to terminate the shock. And then the control group who didn't receive any shocks. In the second phase of the experiment, the dogs in each group were all treated the same. So as you can see in the chart in phase 2, all 3 groups of dogs were treated exactly the same. Each dog was placed into a shuttle box, like the box you see on the screen here, in which its 2 compartments were separated by a small wall. The 2 compartments were the same size and similar in most respects, except the first compartment had a grid floor through which a mild electric shock could be delivered, while the second compartment was safe from shock. Again, as you can see on the graph on the left side, shocks are possible. On the right side, there's no shock. On each trial during the second phase of the experiment, the dogs were placed into the grid floor compartment and a mild shock was delivered. The onset of this shock was always preceded by a signal, which was a dimming of that red light you see mounted on the wall. 10 seconds after the light was dimmed, the electric shock occurred, but if the dog jumped over the partition, it could escape the shock. So for all the dogs, in this condition, the shock was both predictable, it happened 10 seconds after the light dimmed, and it was preventable. So they could jump over the wall in order to avoid the shock. If the dog failed to jump over the partition within 10 seconds, The electric shock started and continued for 1 minute. What we found in phase 2 is the dogs in both the escapable shock and the no shock groups quickly learned to escape the shock in the shuttle box. When shocked, these dogs ran about frantically at first, but then climbed, fell, scrambled, or jumped over the barrier. That is, through trial and error and determination, the dogs learned that if they somehow got over that barrier, they could escape the shock. After only a few trials, these dogs jumped over the barrier to safety as soon as the warning light dimmed. So these dogs learned how to control or prevent the shock. The dogs that were in the inescapable shock group, however, behaved very differently. When shocked, these dogs at first behaved like the other dogs did by running about frantically and howling. However, unlike the dogs in the other two groups, these dogs soon stopped running around and instead whimpered until the shock terminated or the shock ended. After only a few trials, these dogs gave up trying to escape at all and just passively accepted the shock. On subsequent trials, the dogs failed to make any escape movements at all. What these dogs learned in the first phase of the experiment, so in the first phase they learned that their shock was inescapable, this had a carryover effect. In the second phase, the dogs perceived that escape was beyond their control, despite the fact that they actually could control it. So the startling generalization that emerged from this study is that whenever animals are placed in a situation in which they perceive that they have little or no control, they develop the expectation that their future actions will have little or no effect on what happens to them. So being placed in these uncontrollable environments causes them to learn helplessness. The early experiments on learned helplessness used animals as research participants, mostly because the uncontrollable events used in these studies included traumatic events such as an electric shock. Later studies found ways to test the extent to which helplessness applies to humans. For example, in one experiment, an irritating noise was the aversive traumatic stimulus event. The results with humans paralleled the results with dogs, and that participants in the inescapable noise group sat passively and were unwilling to attempt to escape from the noise, whereas participants in the escapable and no noise groups quickly learned to escape the noise by operating a lever. So this shows that humans too learn helplessness. Although researchers have found many new and novel ways to assess learned helplessness in humans, the consistent finding is that people exposed to solvable problems in the first phase of a study solve significantly more problems in the second phase than do people that are exposed to unsolvable problems in the first phase. It is not so much how smart and how clever participants are that matters. Instead, it's how responsive and controllable the environment is while they attempt to solve problems. Learned helplessness theory features 3 components: contingency, cognition, and behavior. Collectively, these 3 components explain the motivational dynamics that unfold as experience teaches people to expect that events in their lives will be beyond their personal control. Contingency refers to the objective relationship between a person's behavior and the environment's outcomes. The environment can be the home, the classroom, the workplace, the sports field, a hospital, interpersonal relationships, a psychology laboratory, etc. And contingency exists on a continuum that ranges from outcomes that occur at random, non-contingent basis, so uncontrollable outcomes, to outcomes that occur in perfect synchronization with a person's voluntary behavior, so completely controllable. So again, we range from completely random and non-contingent, so it's something we can't control, all the way to something that's perfectly in our control. So take a moment to ask yourself what your own experiences have taught you about contingency in the following situations. So think about these situations and think about how much this is in your control versus how much this is random. So getting a traffic ticket, getting a job in your hometown, winning a sports match against a rival, winning the lottery, catching the flu, getting cancer from smoking cigarettes, gaining weight over the holidays, graduating from university. So to characterize the contingency inherent in each of these situations, ask yourself, to what extent does your voluntary strategic behavior influence the outcome in those settings? That is, how much influence does your voluntary coping behavior play a role in avoiding a traffic ticket, avoiding getting the flu, getting a job, winning a contest, winning the lottery, escaping cancer, preventing weight gain, and obtaining a university degree? One thing to keep in mind is when we're talking about contingency, we're talking about the objective relationship, not the subjective relationship. So in a lot of ways, for these things, it can be calculated. So thinking about avoiding a traffic ticket, if you follow all of the traffic laws, you should never get a traffic ticket. So you can have complete control over that situation by following traffic laws. But something like avoiding the flu or getting a job, those are a little bit more tricky to calculate that objective relationship. So that brings us to the idea of cognition, or a person's subjective understanding of personal control. So a good deal of cognitive interpretation takes place between the actual objective environmental contingencies that exist and a person's subjective understanding of personal control in these environments. Our mental events or our thinking distort the relationship between objective contingencies and subjective control. And these events therefore create some margin of error between the objective truth and our subjective understanding. 3 cognitive elements are particularly important: biases, or the illusion of control; attributions, or explanations of why we think we did or did not have control; and expectancies, which are the subjective personal control beliefs we carry over from past experiences into our current situation. To illustrate the importance of cognition, we can ask 2 people who experience the same environmental contingency why it happened. So if we ask 2 people in the room why they got the flu last winter, or why they got into university, or why they have or have not received a traffic ticket, generally people's outcome beliefs and their replies to that question stem not only from the objective information about the world, but also from their unique biases, attributions, and expectancies. So, for example, asking someone why they got a traffic ticket, generally their answer is not just going to be because I was speeding. It's because I was speeding in that bad area, or because I was late for work and I had to drive faster, or I was going to get fired. Again, they don't just break it down to the objective contingency. They don't say the speed limit was 60 and I was driving 80, that's why I got a speeding ticket. They include factors that shouldn't actually be relevant, like the fact that more cops appear on that stretch of road, but they had no choice because they had to go to work. Again, objectively, if they were following the rules, they wouldn't have gotten that speeding ticket. But when we perceive our control in given situations, we don't just take into account the objective relationship, we also consider other factors. So really, to understand learned helplessness, we need to pay attention not only to objective environmental contingencies, or how controllable outcomes really are, but also to subjective personal control beliefs, or how controllable the person thinks those outcomes are. So just as contingency exists on a continuum, coping behaviors to attain or prevent outcomes also exist on a continuum. In a traumatic event, for instance, people's voluntary coping behavior varies from very passive to very active. Giving up characterizes the behavior of a helpless individual, while activity and assertiveness characterizes people who are not helpless. Even given our example of the flu, people vary in how they deal with the flu. Some people say, "I'm sick and there's nothing I can do about it," and lay on the couch for a week. Others are drinking Emergen-C, taking shots of oil of oregano, looking for a sauna to sweat it out. So again, this shows variation in the extent to which people enact coping behaviors. Accordingly, some clinical psychologists view learned helplessness as a model of naturally occurring depression. Learned helplessness and depression are similar in that the same expectations cause both. The individual expects that bad events will occur, and there's nothing that they can do to prevent their occurrence. Learned helplessness and depression also share common symptoms, so passivity, low self-esteem, loss of appetite, and therapeutic intervention strategies, so time, cognitive behavioral modification, etc. One of the most exciting findings to emerge from this research is that depressed individuals sometimes see the events in their lives as less controllable than do individuals who are not depressed. This finding led researchers to wonder whether the depressive tendencies of individuals to see their world as uncontrollable might be the core cause of unipolar depression. Perhaps the root of depression lies in a depressed individual's inability to recognize that they have more control over their life outcomes than they know. But it turns out the results of learned helplessness studies in depressed and non-depressed individuals indicate that people with depression are not more prone to learned helplessness deficits. Rather, it is the individuals who are not depressed who sometimes believe they have more personal control than they actually have. Although this conclusion might sound startling, depressed persons' memories for the positive and negative events in their lives are balanced and equal, whereas the memories of the non-depressed person harbor biases for recalling more of the positive events. And it seems that biasing our memories towards these positive events and remembering the good and letting go of the bad is actually a very adaptive coping strategy for allowing us to maintain optimism and maintain a feeling of control over our life. When people have both the motivation to pursue their goals and ways to achieve these goals, they experience hope. The first part of hope involves high self-efficacy, or the I can do it belief in their capacity to accomplish the goals they set for themselves. The second part of hope involves clear pathways, or the belief that one has multiple and controllable pathways to goal attainment. Together, high self-efficacy supports confidence, while mastery beliefs support optimism. The athlete preparing for a match or the salesperson trying to close a sale feels hope only when they can generate at least one, and often more than one, controllable routes to the desired goal, whether that goal is scoring points or making a sale. Having multiple pathways to goal attainment is important because environmental obstacles, like the opponent's strategy or the competitor's products, often close off some of those pathways, suggesting that no, you will not be able to do this. But closing a pathway to a goal does not actually diminish hope if the performer has a number of alternative pathways to the goal. All goals have obstacles to their eventual attainment, so hope follows from knowing that one has more pathways to a goal than the environment has obstacles to block them. So again, that's an important thing to realize. When working towards a goal, especially a long-term goal, we're always going to experience obstacles. But by having many different routes to achieve that same goal, it allows us to maintain hope that the outcome will still turn out in a way that we want. During athletic performance, high hope track athletes have been shown to outperform low hope athletes during stressful competitions, even when controlling for ability. Similarly, facing physical illness like chronic pain, cancer, blindness, etc., high hope patients remain appropriately energized and focused on finding pathways to cope with their illness, whereas individuals with low hope are generally more in a state of learned helplessness where they just accept whatever's happening to them more passively. So why do high hope individuals outperform and outcope their low hope counterparts? Well, high hope people establish specific and short-term rather than vague and long-term goals. They set mastery or learning goals rather than performance or achievement goals. They rely on self-congruent goals rather than on self-discordant goals. They engage goals with intrinsic rather than extrinsic motivation. They're less easily distracted by external obstacles or by task-irrelevant distracting thoughts and negative feelings. They generate multiple pathways and pursue other avenues when stumped rather than sticking stubbornly with one approach. And they have reservoirs of internally generated determination. I will get this done. I will keep going. From a cognitive motivational point of view, high hope individuals tap into their motivational resources of confidence, self-efficacy, optimism, and mastery beliefs, and in doing so, they find the motivational support to overcome life's challenges and obstacles. So something good to think about is, does your final paper incorporate these things? Again, we've just talked about the fact that people who have high hope outperform people who have low hope. And we talked about how important this is for staying task focused and actually getting to that desired outcome. So does your goal and your plan have all of these strategies embedded into it? If it does, it's probably quite a good goal. So take a break, let your brain rest for a little bit, and I will post a second recording that will cover chapter 11.